host, Angeline Umahosa. I'm the Washington County Health Department's latest intern, and I'm so glad to be hosting you with this presentation today. So thank you. So, why is good communication important? Clear communication with your doctor can significantly impact your journey as a patient by helping you comprehend your medical conditions and treatment options more thoroughly. When you openly share information about your condition with your provider, you empower them to tailor their approach to your specific needs. This then fosters a more collaborative environment where decisions are made with your full understanding and consent. So, the first tip is to have an agenda to help with time. So, it's important to come prepared to your doctor's appointment to make the most out of your time together. And bringing an agenda that outlines the issues or concerns you want to discuss during your visit is can be really important to help you maximize that time. It helps you stay organized and ensure you cover all the important topics within the limited time of your visit. So you may be asking yourself, what does an effective agenda look like? So, an effective agenda has a few components, which include your goal for the visit, a few points relating to that goal that you want to address, and a list of questions relating to your goal. So, goals for your visit can include what is the main problem that you want to address regarding your body, a symptom that you've been having for a while and maybe won't go away, information about a medication you heard that might help you with a chronic condition, or even a referral to another specialist. There will probably be an urge to self diagnose using the internet. Please don't. Instead, include the information you found on the internet in your questions portion of the agenda. Then that can allow your doctor to verify or count out your diagnosis due to your symptoms. So, while the amount of information may seem overwhelming, it's essential to note that patient advocate organizations are dedicated to assisting patients in their communication endeavors. One notable example is the Ask Me 3 initiative. The initiative educates patients about three critical questions patients can incorporate into their discussion with healthcare providers. And by familiarizing patients with these questions, they are better equipped to actively engage with their providers and ensure they receive the necessary information and clarity about their healthcare journey. These three questions are: what is my main problem? What do I need to do? And why is this important to me? So let's go and watch a brief video on how to implement these questions into your visit.
As a patient, you should expect safe care, and you should also take steps to help ensure you receive safe care. Clear communication between you and providers and being an active member of your healthcare team is important for keeping you healthy and safe. Asking your doctors, nurses, and pharmacists and other healthcare providers questions so you understand your main problem, your plan of care, and what you need to do for your main problem is an important first step. Now, more than ever, patient and family engagement is needed to help you receive the best healthcare possible. You are an important part of the healthcare team. Be an active member of your healthcare team. Ask questions early and ask questions often. The National Patient Safety Foundation encourages you, the patient, to be an active member of your healthcare team by asking three simple but important questions every time you talk with a healthcare provider. The three questions are: what is my main problem? What do I need to do? Why is it important for me to do this? Ask me three. Good questions for your good health.
Joe, I think your shortness of breath and swelling are caused by congestive heart failure. We need to schedule an echocardiogram to find out what the cause is. The echocardiogram will determine your ejection fraction and if there are any underlying issues with your heart valves. In the meantime, I'm going to start you on a couple of medications: Lotensin for your high blood pressure and Lasix for the swelling.
Okay.
Do either of you have any questions?
So I have high blood pressure? Is that my main medical problem?
No, high blood pressure is not your main problem. Your main problem is congestive heart failure. This condition causes your heart to be weaker and have to work harder to pump blood through your body. It can cause swelling in your legs and it can cause shortness of breath.
Okay, I think my brother may have the same condition. What do I need to do?
First, before you leave, let's schedule an appointment for your test. After you leave, you need to get your 2 prescriptions filled. And finally, you need to take your Lotensin and Lasix. I suggest that your daughter and you write up a schedule for your medication.
A written schedule of my father's medications will help. Why is it so important for him to have the test and take these medications?
Those are really good questions. The echocardiogram will hopefully tell us exactly what's causing the heart failure. The test will also help us find out how far along the heart failure is. It's important to take your medications because you're helping your heart not work as hard. The swelling will decrease or disappear, and you're slowing down the disease. Does that help you understand why the test and medications are important?
Yes.
Yes, I understand. I'll make sure to schedule my tests and take my medications.
In this scenario, Joe asked 3 simple but important questions. By asking questions, Joe was able to be more informed about his main problem and everything he needed to do. Also, his family member was seen writing down the information. When you visit your doctor, if you're in the hospital or at the pharmacy, always ask and write down the answers to these questions. What is my main problem? What do I need to do? Why is it important for me to do this? For more information about Ask Me 3 and communicating well with your healthcare providers, visit www.npsf.org.
So, the Washington County Health Department does have a pre-made agenda tool that incorporates all the information we just talked about. And below, you can find the pathway to download that tool and take it to your next doctor's appointment. So, the next tip is to consider bringing a close family member or close friend for support. Having someone with you can be really helpful, so they can provide you that emotional support and be your advocate, as well as bringing that additional point of view that you may not know you need. Another reason why you should consider bringing a close friend or family member to your visit is that they can be a second ear to information you may miss or forget. And they can also be a note taker during your visit so you can primarily focus on what your doctor is saying. So, if you're making the effort to go see your doctor, you should get the most out of your visit. So, try your best to be honest and open. With regard to being honest, you may be a little shy about certain topics, especially when we're talking about things like sexual activity, alcohol or drug use, or other sensitive topics. However, most doctors have heard just about everything. They're not here to judge you, but to help you, meaning they need all the information you have relating to the problem that you come in. Mention symptoms even if you think it's not important. With regard to being open, communicate your feelings about how your visit is going with your provider. For example, if you use English as a second language and don't understand what your doctor is saying, tell them. And by law, a medical interpreter should be available to you so you can understand what your doctor is saying regarding your health, leading to a better experience. Your provider and yourself should have a relationship based on honesty, understanding, and mutual respect. So, by discussing things like lifestyle and relationships and social obligations, it can really help your doctor gain a more holistic understanding of your health. With regard to lifestyle, your doctor can identify any factors that may be affecting your health and provide more targeted advice or interventions. And understanding your relationships and social obligations can be important for treatment planning. For example, if you have a demanding job or caregiving responsibilities, the doctor may need to consider these factors when recommending treatment options or lifestyle changes. Finally, the last tip is know how to access your medical records. Medical records are not just important for your doctors, but down the road to ensure that all your providers have up to date information on your medical history. This also helps you as an individual fact check the accuracy of the health information provided. Knowing how to access your records also helps empower you by taking a more active role in your healthcare. Good record systems should allow you to better understand your health conditions, treatments, and test results, allowing you to ask more informed questions and advocate for yourself. It's also best to reach out to your doctor for instructions on how to access their specific systems if you have any troubleshooting issues. Additionally, there is also a common misconception that health departments like us have wide access to medical records. And while we do for some things like birth certificates and death certificates or even disease surveillance, we're not usually able to provide a copy of these records unless you're a primary patient or client of ours, or if it's a special circumstances like getting a COVID test result. So that was a lot of information. So let's just overview a key points that we want to remember moving forward. Could bring an agenda to help with time management, and that will allow you to have more of a structured visit. And within that agenda, come in with a clear goal or objective for your medical visit. And within that goal, have points you want to discuss and allow yourself to have those questions you want to discuss as well. If you need help figuring out what to put into your agenda, use the Ask Me Three technique. Remember, what is my main problem? What do I need to do about it? And why is it important for me to do this? This can really help enhance that communication between yourself and your provider and to help with clarity and understanding during your appointments. Remember to be honest and open about your lifestyle, relationships, and social obligations. Consider bringing a family or friend to your visits as they can provide that emotional support, help you remember important information, and ask those additional questions you may not even think of during the appointment. It's particularly helpful to consider bringing someone when it's a complex or stressful medical situation. Finally, know how to access your medical records. It's really important as it ensures accuracy, it helps facilitate informed decision making, and it helps you as a patient participate in your healthcare management. Thank you for taking the time to come to this webinar. We hope our team helped you provide you with a better understanding of how to effectively communicate with your provider. So we're going to open the floor to some questions in the Q&A box, as well as put that exit poll we talked about at the beginning of this webinar. And Stephanie, you can go ahead and open that up.
Okay, and the poll should be live now for everyone. There'll be two questions. Okay, so the poll should be wrapped up. And if anyone has any questions, again, you can enter those into the Q&A section.
Looks like we have a bit of a highlight. Thank you, Sahir. She said, I wanted to say this was very helpful learning how to talk to our doctors, something we aren't normally taught. Great tips. Thank you. And Stephanie, will this webinar be posted on our resources page or?
So we're going to be uploading it to our YouTube page. So that way it'll be there for everyone. If they kind of want to reference back to it, it'll be posted there for everyone to see.
Okay, great. And are there any more questions that anyone would have? Thank you. Thank you for coming, everyone. Really appreciate it. We're looking forward to possibly having more webinars in the future. And I really appreciate you all for coming. Thank you.